Hi, my name is Dr. Winnie Nyanya, a public health specialist specializing in HIV care. I've partnered with Ponea Health today to talk about HIV awareness. One can be able to know their HIV status through different modalities. In Kenya, you can visit a health facility where you can be tested with the support of a healthcare provider and given your results and counseling. If you're not comfortable visiting a health facility, you can be able to test yourself, get to know your HIV status in the privacy of your own home, and based on the results, visit a health facility to be supported to either remain negative or to remain positive. Those who are at high risk of getting HIV, in terms of populations that have multiple sexual partners or are sex workers or have sex with men, they are able to be supported to prevent getting HIV positive through treatment that is called pre-exposure prophylaxis. And this medicine is taken by this population to prevent them being infected when they are exposed to HIV. Those who are HIV infected also can reduce the risk of transmission through staying on treatment and being virally suppressed. And when they are virally suppressed, the risk of transmission to their partner or to their baby is significantly reduced. People living with HIV can continue to live a healthy life by making sure that they take good care of themselves. First, it's by ensuring that they take their medication as prescribed by a health provider. The second thing is to ensure that whenever they are unwell, they seek medical support to be able to address whatever health issue they have. The other thing is to ensure that they continue maintaining a healthy lifestyle by drinking water as required, by exercising, by avoiding stress, and also sleeping the healthy required hours. They also need to eat a healthy, balanced diet. If a person living with HIV has their immunity severely compromised, they can be supported through provision of supplements that can be dietary supplements that support them to build their immunity and bring it back to where it's supposed to be. If their immunity is good but they are malnourished, then they can be supported with advice on locally available foods that can be able to help them get back to good health. People living with HIV are supported to maintain a healthy lifestyle by retaining the weight that is expected for their height. Those who are overweight because of one reason or another are at risk of developing other diseases which are associated with lifestyle, like hypertension and diabetes. Therefore, they'll be supported to retain the normal weight that will avoid risk of exposure of getting these other non-communicable diseases. Therefore, they'll be supported to exercise and eat healthy, locally available foods that will help them retain that weight. And also remember to drink water as expected. People living with HIV are also at risk of exposure of developing other non-communicable diseases. And this is because as they advance with age and their HIV is well maintained, they live longer and are also at a risk of developing other non-communicable diseases like hypertension and diabetes. People living with HIV should ensure that they continue visiting the health facility for their routine follow-up and checkups, so that if they have any concomitant illness like diabetes or hypertension, it is diagnosed early and they are put on treatment to ensure that they have good outcomes, not only for HIV, but for any other illness that they may be having. Thank you for joining me in this discussion. You can book my services at ponea.com. I look forward to engaging with you more in the next episode. Thank you.